Well, thank you very much for inviting me. I think yesterday evening, this won't go down well if someone's watching this on the YouTube segment, but for the audience here who were here yesterday, I think Professor Pitt said something like, at the end of the day, they did the plenary here, and they said it's like going on after the Rolling Stones. Well, right now, I feel like I'm going after Stevie Wonder, Prince, and Beyonce. So they've stolen most of my best lines. But anyway, so what I'm going to do now is I might go slightly off script or try to sort of add a bit more flavour or a bit more background to the sort of headlines that you'll see there. So I hope it works, but forgive me if I'm a bit back and forth with it. So what happened was after I think most of you will know, we did the Judicial review in the UK, the Kira Bell case as it became known. But what happened out of that is because Marcus and I both sort of spoke publicly, and at that time, there weren't really any other clinicians out, as it were. There are a lot more now, thankfully, in the UK. But what we noticed was we were getting a lot of parents who had seen us somewhere, writing to us and saying, please help. Because they couldn't feel that they trusted the mental health services that were available because there was a lot of capture going on. And as Marcus said, the Affirmation Model was seriously letting down children and their families. So we started to agree to see some of the patients. Marcus took the adult patients, and then I started to do some work with some of the children. But what happened was, if the parents put me in contact with, say, a 14-year-old, and I just met them from that moment, it's a really difficult starting point. It's not impossible with some kids, but with this particular cohort of kids, it is a tough place to start. So then what I felt I needed to do was to do what I think is ordinary good assessment work. And I don't think you can do that by a questionnaire. I think I'm going to put that out there today. I think good assessment work needs to be an interactional process. It's not an online thing that you fill in with tick boxes, because I think we all know that a lot of our young kids, the patients, can either have learned a script, which they give the right answers, in inverted commas, to your questions, or they don't really know the answers to those questions, or they give an answer, but actually you'll learn as you go on in an interactional relationship with the kid that what lies beneath is a very different answer. So I'm just going to say that about assessment tools. But I think what I started to develop was a very ordinary, really like a family assessment model. I had a colleague who was also a child analyst, and what he and I used to do was we used to meet parents alone for the first session. We would take a history, I'll come back to that in a moment, and then we would see, one of us would see the child, and sometimes that depended on whether it was a girl or a boy or there was a preference, but one of us would see the child, and then we would both come back together and see the parents again for another session at the end of that process. And the reason for the separation was, when I found I was trying to do it all, I found it got really quite complicated, because your child does feel you're an agent of the parent, and also there are issues around confidentiality. And so this model for me worked really well. I'm not saying that there aren't other models available, but so I think it's good ordinary family mental health assessment work that we're doing, but I'll tell you a bit about it. So how we start the first one, we sort of lay the land out in terms of saying to the parents, we want you to feel this is a confidential space, and there's no judgment here. We really want to hear how you feel, not what you think we ought to hear, what you think you ought to say. So they usually tell us a bit about what's been going on with the child and what's happened. And exactly as you were saying, Stephen, that there's a sense of shock and crisis. And I think the first important thing is to try and help the parents feel that they've got somewhere safe, where we can hear what they want to say, and that they can trust that it's a sort of non-judgmental environment where they can be honest about not only the history of the child, but also about their feelings towards that. So we go into a history of what's gone on. We look at whether there have been illnesses in the background of the child, any significant losses, either to the parents. Sometimes the parents have lost their own parent when the child was very young, or we look at whether there have been illnesses or losses in terms of other siblings, because as Marcus said, quite often the attention gets taken away and directed towards one of the other children in the family. The other thing is, and in our book, and I'm going to mention the title here, it's called Gender Dysphoria, a Therapeutic Model, and it's available on Amazon, so there we are, we've done our selling pitch. But one of the things we talk about is trauma with a small t, because what I keep hearing repeated, and I don't think it's completely my experience in this work, is people talk about complex histories, trauma, abuse and so on. And I think what it doesn't quite explain, that sort of label that gets written about, is that it's very nuanced. And something like a younger sibling being born and taking mummy away from me and to the younger sibling can feel like a terrible trauma to some children. To some other children, they're delighted. They've got someone to play with and who's taken the focus off them. So, but we try and explore how the child's reacted to any of those situations. We try and get a sense of whether there are any attractions going on, whether they feel there's a sort of sexual interest or a life bubbling in the background. Again, as Marcus said, one of the common things we find is very often they say, no, they've not said anything, we're not getting anything. And I think that's partly common to adolescents, but on the other hand, I think in other groups of children, you start to see it emerging. They can't keep it secret that they keep going back to look at Beyonce on her latest video or whatever, and replaying films that they enjoy and that kind of thing. So anyway, the history from the couple is very much trying to begin to get a flavour of how the parents relate, again, not only to the child, but to each other. And what I would say about that is that the parents may have both arrived at the consultation together. And let me just say, I have seen parents who are separated. One of the great things about online work and Zoom, we weren't sure how it would work out, is that separated parents could both come online together, and we have managed to do work like that, and that was very helpful as well if the parents were able to do it. I also do see single parents as well, but I think the main thing is that you start to pick up both how the parents have responded to the child, but also how they respond to each other. And then I think if you explore that further with the parents, you may begin to hear from the parents something that maybe when they're just with their partner, they haven't been able to voice. So they might be able to say something a bit more about their particular upset or their particular history, which they've felt they've had, because they're trying to be a team together and approach the child. Maybe it's not so easy to say other things. I feel like I'm going to say this a lot in this talk, again, as has been said previously. I think that sometimes one parent can be a lot more upset than the other. I, interestingly, find that often it's the parent who, the mother who feels deeply traumatized and sort of weeps almost as soon as you say, how are you feeling? Because it feels like a terrible injury. It's just so painful to be with in the room. But it's curious how I've often noticed that some of the fathers, particularly if they've got daughters, seem to be a bit more... Now, I don't want fathers to scream, because I know there are other fathers who are absolutely in bits about this. And it's very hard when you talk about this subject because it's a spectrum. But again, I'm just trying to elaborate on this because it's important to make that observation. because parents aren't just parents. They're working as a couple, hopefully, but they are also individuals. And it is so interesting how very often you will find out about the parental couple and their family history. And as Bob and Stephen and Marcus have all alluded to, there's something there unconsciously being replayed out in their relationship with their child that either they don't want to repeat or it is being unconsciously repeated. So I always talk to them about how they feel they get on with their kids, and it's very commonplace that they say, oh, we've been the best of friends. You know, the kid doesn't argue, we've got on really well, and this is the only thing we argue about, which it has significance in its own right. But what I think also I'm keen to learn about is whether or not the child has, within the family, not only got on, but really relates in a more inter-reactional way. It's like inchoate. There we are, Steve. We're all going to come back to your word now, inchoate. But I think, you know, so for example, I would say if your child sees you upset, how would they respond to that? You know, if they talk about these arguments, how do they respond to that? Because it's interesting to see how then you get a picture developing of whether the child has some empathy and some guilt towards the parents, or whether the child is in a much more removed state of mind where they are so encapsulated in this obsession of transitioning that they sort of really can't allow anything in. Some parents are totally tyrannised by the child, and I think this can be both sort of an internal dynamic where parents just want to be able to get on and they don't want to maybe repeat something that they had with their parents, so they become almost tyrannised by the child and they kind of feel they've got to go along and not upset their child. The other thing is, I do think the charities and social media at large and the sort of trans advocacy groups have something to answer for, because I think the whole suicide myth, which has now been dispersed and dispelled as a myth, it's not to say there's not some risk in this group of kids, but it's very similar to other adolescents who are having difficulties with adolescents. So it's not a higher risk if you don't affirm your child, and I think it's really important to say that. And for us to keep repeating that. Marcus has already talked about the highly critical mind of the children, but I think again in the work, when I've often worked with the kids and some of the longer term work, because a few of these kids I have taken into longer term treatment, and you do really start to see how the critical mind gets at them, but actually what also starts to develop in the work, in the transference sometimes, is that you start to experience the criticism. I see it as a good sign. It sounds a weird thing to say and contraindicative, but I feel once a patient starts to criticize me and be more open about hostility or annoyance or aggression or whatever, I feel we're getting somewhere, because we're bringing things back into the room and you're beginning to uncover some of the things that are trying to be covered over by this new identity. What are we trying to do in the work? Again, it's about this idea of trying to help the parents re-establish their role, both as a couple, but as parents, kind of that expression like getting back in your parental seat, because I think often parents have felt really pushed out of their seat by this whole process. And again, I am horrified when I learn about mental health professionals excluding parents or criticising parents. I absolutely feel that any parent has a right to come into the room and say to me anything they feel they want to say. And to not feel judged by that. Now, of course, you know, we all know that when we say things, we're going to think, oh, someone's going to think I'm awful to say this. But I do think for the work to be of value, you really have to create an environment in mental health work where in the assessment, people feel that they can trust you to tell you something. You won't immediately congratulate them on them or affirm them on it. But what you're also not going to do is offer any criticism to that. You're going to open it out and try and explore how that person is feeling. And that goes for the parents and the child. We're always trying to look at the bigger picture. So this thing about sort of holistic therapy and so on, I think that the picture is you're always trying to widen things out. And when I see the kids, again, like Marcus, I see the younger kids, but I very, very rarely talk. I mean, if they bring it up, we'll go there. But I'm always trying to talk about social relationships and what goes on at school and who's had an argument and what so-and-so thought and why they don't feel they're comfortable to do this, that, and the other. I try and look at dreams with the kids, and I try and ask them about their friends. If they've got an anime cartoon character that they've identified with, I ask them what the characteristics are of the character, to try and get something going for them, because often they're just not wanting to think. They're just wanting to go, leave this person, go to this new identity with none of the problems. I think, and I'm going to just talk a bit about this, I think the most terrible thing, I don't know why I feel emotional about it, sorry. I think the most terrible thing for parents is to feel that they're about to lose their child. I'm really sorry, I don't know why I got so emotional. Sorry about this. But I do also think that, because what started to happen more recently is that I've started to see a lot more of the parents of the adult children, because obviously we've had CAS, so the younger age group, the panic's not quite so much there in the UK with the younger children. But it's some of the adult children's parents are contacting me. And I think part of the work I have to do with them is to also address the issue of mourning and loss and separation. And it's not that we go straight there, but I think it's a really important part of the picture, because the tragedy is, at the moment, with things as they are, some of our kids are going to do damage to themselves by transitioning and then regretting it perhaps later. Even if they don't regret it, there will, exactly as you said, Stephen, there are losses that have to be faced ahead, because even if you feel that transition is the right decision for you, there are still things that are not going to be available to you in the same way that they would have been perhaps if you hadn't transitioned. There are always going to be difficulties and challenges, and don't shoot me for this, because, transition people should have the equal opportunity of care and human rights and so on. Of course, I'm not going to go into the political realms, but I think there is a difference between that and what's being demanded. So, but to acknowledge the difficulty of the life, both with the child, I think, is helpful. And it's not to be trying to terrify them with it, but it's important to consider the losses. But as I say, to come back to the mourning aspect, I do think part of my role is to prepare the parents for the idea that they may not be able to prevent a transition. It's their worst fear, perhaps in many cases, but sometimes the child does have to go through, or the young adult has to go through something, and then we have to try and help in the aftermath of that. And there are detransitioners today who are going to help us learn how to do that in the future, and we're working with some of them now. So I think that's going to be a learning curve for all of us, to try and help put back together what we've created here. Parents worry about conflict, I think, and I don't know whether it's a change in the generations, because I think my generation of parents were quite terrifying, and I used to go and visit my friends' parents and just sort of call them Mr. and Mrs. So-and-so and feel I couldn't put a foot wrong and always said, thank you very much for having me. And I think it's different these days, but I think it's important that both parents and their kids learn to be able to have disagreement, different points of view, but to feel that it's not a disaster. So it's that, again, it's like helping parents think of ways that they can agree to differ, which is different than from sort of butting heads and keep trying to force your view, because it just doesn't really go anywhere. Yeah, and then there's the issue there that I've put, which is this fear again about, and a lot of parents say that they are terrified because the kids say, if you don't agree with me, I will disown you. And obviously, once you've got to know your parents, I mean, there may be different dynamics, but something I quite commonly come across is that notion again, that something has been split off from the child or the young adult, the anxiety, it gets put into the parents. And so the parents are worrying, and the kids just going, I don't even have to really think about this. I just know where I'm going. I don't have to have any of this anxiety. So it's often about sort of noticing within the parental couple. It could be little things they do, but you know, they've got all the research maybe, and they've got all the articles, and they're sort of watching videos, and the child's upstairs playing on, you know, PlayStation or whatever it is. And I think there's a way sometimes for the adult parents, parents of adult children, you just have to help them get to a place where they go, well, you've said what you can, you know, you can hold those views, you don't have to agree with it, you don't have to go, we're over here now with the transition, but you can find a way to sort of calm down a bit, as you were saying, Stephen, calm down a bit. The fighting, the sort of crisis fighting, as if it's sort of got to be rammed home. And it's so interesting how many times when we've observed that dynamic with the parents, and they kind of slightly change something behaviourally at home, that they've come back and said, oh, that was interesting. We actually had a talk about something, or we noticed she's not wearing her binder anymore, or, you know, just little things that have gone on. So, right. I think I've done that. Oh, splits. Sorry, yes, I'm just going to talk about that. The splits in the parental relationship. If there is that wide range of views, I think it's very helpful for parents to be able to air that with each other, with someone in the room with them who's containing that, because sometimes they can't do it when they're on their own, but I do think it's important that the two parents can hear each other's voice, and sometimes one does drown out the other. Don't shoot me for saying that, but it can happen. You know, that one view dominates from the parental couple. So it's quite good to encourage an exchange of views in the room. Yeah, so purpose and aims, again, I feel this has sort of largely been covered by Stephen here, but it may feel when you're in the crisis as a parent, and it does feel disastrous, and it maybe is disastrous, you know, at many levels. But I think the aim is to try and help restore a bit of calm, a sense of containment, that's a word we use, to make them feel these things can be borne. And actually it's what we do in the clinical work as well, you know, the thoughts that can't be thought, or the words that can't be spoken. You're trying to restore a sense in the room that things can be thought about, and nobody dies when you do that, hopefully. I'm straight away thinking, oh, someone's going to tell me after the talk, you know, but I know how serious it is. I don't. It's nothing. Yeah. Okay. Out of the process, hopefully what starts to happen is that the child starts to feel that the parents can have their concerns, but they can also listen to the child. So rather than this, as I say, the butting heads scenario, you've got more of a listening project going on. And it's about not immediately coming back with a rebuttal. It's about, oh, okay, I think I understand what you're saying, or that kind of thing. And again, it's not sort of giving them a manual of how to, but it's in the work, when you hear how they think, you can maybe reflect on a way of understanding that, and then maybe they take that away. And so it's sort of just like a gradual. I'm glad to see Sasha's nodding at me over there. Okay. And again, I sort of feel we've had this, so how am I doing for time? 5 minutes, okay. So we can come back to sort of this a bit more in the session after the break. But I think that it's important to say, because I think one of the things that came out of the Cass review, and again, what I keep seeing in the newspapers now and journalists writing about is, and holistic therapy and, children have therapy. Some of these kids won't come into therapy, and I think we have to be honest about that. So we've got to also be thinking about ways to support the parents and the family in their immediate situation, but I think we've also got to think more widely. And of course, I think one of the reasons many of us are here today is because we're trying to change the way this has been approached. And I cannot emphasize enough how much I disagree with the affirmation model. And people always accuse you of being transphobic or not valuing the child's intrinsic sense of self. But I think that it's the opposite. I think if you don't immediately accept what a child says about them, because if you listen to what the child's saying, very often they're going, I hate me. I hate my body, I hate my hips, I hate my breasts, I hate my penis, I hate men, I hate, women, whatever. But they're saying they hate that about themselves. And I think the problem with affirming a child in that state of mind is that, A, you're not giving them a chance to explore any of their own doubts, which will be there somewhere, tucked away. But the other thing is, you're kind of agreeing with them that there is something wrong with them. And I think what's going on with these kids is that they're just trying to deal with the complexities of adolescence and growing up and separation and sex in this current social media ridden world, and this crazy world, actually. I think we've all gone a bit mad lately. But we're trying to say to them, we believe that you can do this another way. We believe you have the capacity to think about yourself, to learn about yourself, to explore yourself, and to accept the nice things about you. And again, it's important to emphasize the talents and the gifts and so on, but also that you can accept the nastier, and I'll put that in inverted, your aggression or your jealousies or your rivalries, because kids really struggle with that a lot. We all do, actually. None of us like to show the less palatable parts of ourselves, but I really think that if you can engage the kids in some way, I'm not just saying in a psychoanalytic way, but in some way with beginning to look at this, you can help them learn, it sounds a cliche, but to love themselves more and to feel it's safe, to love yourself exactly as you are. Whoever you are, however you are, whoever you want to love, however you want to dress, learn to love who you are as you are. I'll stop there.